Hello, welcome to the Motivational Midwife. My name's Lynn Jones, and today we're going to look at peanut balls and how to use them effectively. So let's look at peanut balls and how to use them effectively. So they work very well with biomechanical techniques, as both aim to create more space for that baby to make its way through the birth canal. And they can both aid in resolving labour dystocia, but we're going to focus mainly, as I say, on peanut balls today. Sherry Grant wrote the Peanut Ball book, which you can get on Amazon. It's very useful and very interesting. I was completely oblivious to the fact that there was, lots of different things you could do with a peanut ball other than just pop it between someone's legs and hope that it worked. And Wendy Proctor, who at time of recording is the only accredited UK peanut ball instructor, runs a online course which is very good, which I did and was very informative, and also she does face-to-face training now as well. Key point really to make, and it's one I was completely unaware of until I'd done Wendy's course, and thanks to Wendy for allowing me to use some of her pictures as well, is that one size does not fit all and that there are more than one size of peanut ball. I was completely unaware that there was more than one size. I thought we just had a peanut ball and that was it. And I suspect for most of you in hospitals, you do just have the one size, which is kind of the most common size. They vary slightly from manufacturer to manufacturer, so they'll either be 35-40 centimetres or 45-50, 55-60 or 65-70 centimetres, depending on the manufacturer. The larger ones are the only ones that are actually appropriate for sitting on, and you might use those for women who are being induced potentially. And it is important that you size them correctly, and we'll look at that in a minute. But it's mainly done on the client's height and the position that you're going to use as well, because you may use different sized balls depending on the effect that you want to achieve. So generally the smaller balls are for your shorter clients, your 5'4" and less, which would include me, or those with clients with shorter legs. Now, interestingly, although I'm only 5'1", I don't know what these are in meters, by the way, because I'm still in feet and inches. I'm an old person. I'm only 5'1", but I have got long legs, so actually the small ball is not that appropriate for me. It's the medium-sized one, the most common one, the 50 centimetre one, which actually fits me better. And then your 60 centimetre or 55 centimetre one would be for your taller clients, your 5'7" and over. Really important that they're stored properly and cleaned properly, so they need to be off the ground, kept at room temperature, and obviously keep away from sharp objects. Direct sunlight and high temperatures can affect the integrity of the material that they're made from. Obviously cover them up if possible and clean after each use. Hot soapy water or the Clini wipes that most hospitals have is sufficient. Ideally you should be covering them while you're using them as well with either towels or a draw sheet or an Inco pad, so that they don't get soiled. So measuring is really important. Now that they will vary depending on your manufacturers as to how you measure them. So these balls, which are my ones, they're from Sensory Direct, and to measure those you measure from the point at which you're putting the air in down to the saddle, and that would be your 40 centimetres or 35 centimetres. For other manufacturers, you lay the ball on its side and you go from the floor to the height of the highest bit. Check them every 3 months because they do deflate. And initially, when you get them, really only pump them up to about 80% of their total inflation and leave it for 24 hours to settle. It's really important they don't overinflate them. You're not going to get the best results if you've overinflated the ball. There are some cautions and contraindications. So anyone that's got any pelvic problems, had previous pelvic surgery, symphysis pubis dysfunction, pelvic girdle pain, all of those things, ankle and hip problems, you may need to either modify what you do or don't do it at all. Anyone with an active DVT, then you're going to obviously change positions much more frequently anyway, and you might be cautious on some of the positions you actually choose. Really, using a peanut ball is no different to placing pillows between the client's legs or putting a leg in a stirrup when they're on the side. Please listen to the clients. You know, if somebody says it doesn't feel right, doesn't feel good, it's not comfortable, then don't use it. Don't leave patients in the same position for any length of time. Not that there's been any problems, but a lot of these times you'll be using a peanut ball is more likely to be with people who have epidurals and are less mobile. Therefore, you need to be thinking about their skin integrity, so you want to be changing position fairly frequently so they don't develop any pressure area problems. So looking at getting the fit right, if it's too big, you're going to cause a lot of torque on the lateral aspect of the hip, and therefore, instead of relaxing that area, it's actually going to be tense and guarding it. So if it's too small, you can see in the middle picture that her ankle is really just, and the whole leg is overhanging the ball. So really that's not going to be effective. And if you were trying to use this from an outlet perspective, it's actually closing the outlet rather than opening it. So size for height of the client you've got, however, as I say, depends very much on the position that you're trying to achieve, the effect you're trying to achieve as to which size ball you'll use. So it's important to know where you think the problem is. So if we get our pelvis, is it an inlet problem? Is it a mid-pelvis problem? Or is it an outlet problem? Because where you think the issue is will very much depend on the position that you might use and where you place that ball to actually get the desired effect. So inlet problems, a little thing you can do just to demonstrate this is if you get your fingers and you sit on your hands so that you can feel your sit bones, you can feel those bony tuberosities there that you're sitting on your sit bones, and just have your legs parallel and your feet parallel out in front of you, and just notice where your fingers are, and then turn your knees out and notice what happens to those bones. Do they get closer together? And then turn your knees in to face each other, and you'll notice that those sit bones go further apart. So you're creating more space. So your knees are attached to your pelvis, obviously. And so the position of those knees and ankles actually will have an effect on the femur. So your femur here, as to whether you're internally rotating it or externally rotating it. So for an inlet problem, if you think there's a high, the presenting part, the baby's head's high, and you want a bit more, create a bit more space for that inlet, then you want your knees out and your heels together facing each other. Toes out, ideally. Wendy's client here hasn't got her toes out, but toes are less important than knees. And that is going to create more space at the inlet. And here's some pictures of positions that actually will create that more space in the inlet. So there's the one we've just seen on the other page, and then this top right hand one is actually called a flying cowgirl. So legs here are parallel, but the hips are pushed forward, and the back is slightly arched backwards, so you're creating more space for the inlet. But you can see, even though in the bottom right hand picture we've still got, even though she's using the ball under one leg, we've still got knees that are apart and ankles that are facing each other. So from a mid-pelvis point of view, you obviously want everything parallel then. So you can see here Mariana's got her knees and feet all parallel, and she's using the ball in this instance to lean on rather than between her legs at all. But everything is facing forward. Useful if you've got a baby that's sort of at spines, you think it's maybe not got enough space to move a little bit further. I mean, one of the key things I would say is if it's not broken, try and fix it. So if everything is progressing very nicely, then you don't really need to use any of these techniques, but they are useful if you think there's a dystocia. And so here's some examples. Again, we've got Mariana in the corner with the one we've just seen, but you can see it a little bit clearer here. Here's a lying down one. We've still got legs parallel and ankles parallel, quite a nice resting position. And here she's using a ball to lean on, and it's more of an asynclitic one, but it's still going to affect that mid-pelvis. And then the outlet, of course, is going to be opposite to the inlet. So you'll want your knees together and your heels out and toes more in. Useful if you can see the baby, it's below the outlet, but you just want a bit more space to get that baby around. And this is one I've used very effectively a lot of times, particularly with women with epidurals. And there is quite a lot of good evidence in reducing the rates of cesarean section rate using peanut balls with epidurals. So here you can see, using the peanut ball, we've got in the top one, we've actually got those knees together and the ankles out more. And that's great. So you can see you position that ball much lower down than you perhaps have historically used it, depending on where you're wanting that effect to be on the pelvis. The bottom one is actually a tuck position. So although her legs are parallel there, it's very good for second stage and pushing because she'll actually be pulling that ball into herself and tucking while she's doing it. So as I say, knees are everything. They're connected to your pelvis. Everything is connected with fascia, which you're trying to create a little bit of length and flexibility in. For asynclitic positions, you may want both internal and external rotation of a femur. So epidurals, again, you may, depending on what you're going to use, you might want to change the size of balls. These ones are the colours that I've put on here, but actually depending on the manufacturer, you may have completely different colours. So it's really important that you've actually measured it and you know what size it is. Try and fit the size of the ball with someone that's got an epidural before they actually have the epidural. If you know that they're going to want an epidural, then it's useful to have sized that ball first so that you know if you're going to use it that you've actually got the correct size. So semi-sitting lunges, that's going to be an inlet position, as we said. And here you can see we've got knees out, ankles more together. And variations of a theme there. Be mindful about the range of movement in limbs if they've got an epidural, because obviously if they've got quite a dense epidural, they're not going to necessarily feel that it's overstretched. And this is a really good one for opening the inlet as well. So the top two are the same one, it's just at a different angle. And the bottom one is called a fire hydrant, again, very useful for mid-pelvis. So in conclusion, we've got, make sure you've got the right size ball for the client in whatever position it is they're in, the right size peanut ball in relation to their height and their torso and their legs. Adjust the size accordingly. Make sure that ideally hospitals and birthing centres should have all of the 4 sizes. Historically, from my experience, as I say, they've generally only had the one size, which is the average size. And all birth workers should have access to all different sizes of balls. I would encourage you to do Wendy's peanut ball course online. It's not hugely expensive and it is very informative. Equally, I would encourage you to get Sherry Grant's book, also very informative. And here we've got some of the evidence, some of the randomized control trials and other research that's supporting the effectiveness of peanut balls in labour and also reducing caesarean section rates. And there you have it, an insight into how to use peanut balls effectively. I hope you found it useful. I look forward to seeing you next time. If you haven't subscribed to the channel, please do so, and also follow us on the Motivational Midwife on Facebook.